We're going to talk about treating hands next. So with our equipment, as you know, there's multiple heads that you can use on the handpiece to treat. And for hands, this is where it really comes into value, because you'll have three options, or you can use all five, but the three that we recommend when treating hands are our smaller hand pieces. And we'll show you why that's important in a second. But you can go off contact with our small cone, our flathead window. The spot sizes on these are very close to being similar, but if you have a preference for one or the other, you can use whichever one you like. And then if you wanted to stay on contact, we have the small massage ball. That allows you to treat the soft tissues if you were working around, say, a thumb, or a place where you wanted to get into a tendon and maybe move things around a little bit with some warmth. This gives you the ability to do that. When you're treating the fingers in the hand, usually going off contact's a little bit easier, just because you'll be able to move around the digit and be circumferential around a joint without having to negotiate around being on contact. But again, it's totally up to the provider to use the head that they choose. So in this case, let's say we were going to treat your thumb. You first have to figure out how big is the area that I'm going to treat. So it's a little tough with the hand, because we like to say that a claw grip is roughly 100 centimeters squared, or the size of a CD-ROM or a 3x5 card. So with a thumb, that would be roughly, call it 20% of 100. So for an area, we would call this 20 centimeters squared for an area. It's a general guess. It doesn't have to be perfect. You just want to be in the right ballpark. Next, you're going to think about what kind of power do I want to use. We recommend generally between 6 and 14 watts for the hand. You have to take into consideration how acute the problem is versus how chronic it is. The darker the skin tone, you generally want to put a little more dose in, because there's going to be more light absorbed at the surface, which makes the treatment less efficient. So chronicity, how acute, skin tone, and the problem you're trying to address, all those things are going to factor into that dose window between the power of 6 to 14 watts and 6 to 10 joules per centimeter squared. More chronic problems, arthritis, things that are just painful, you want to be closer to the 10 side. If it was more of a post-surgical or an acute inflammatory problem, you want to be on the lower side of that dose, around 6 joules per centimeter squared. So let's take a look at how easy that is to set up if you have our perfect protocol. You're going to go to your operations screen, hit perfect protocol. We said that our area is roughly going to be 20 centimeters squared. So the first box is 20. Power, you have some flexibility there. It's going to be between 6 and 14 watts. Let's say it was 10 watts. And then for dose, again, you have some variability there, 6 to 10 joules per centimeter squared. Our patient today is very fair complected, so and we'll call this a chronic problem. So we're going to just middle it between the 6 and 10 at 8 joules per centimeter squared. And then hit calculate. And what this is saying, since we chose 10 watts of power, the treatment's only going to take 16 seconds to deliver 160 joules of energy. So some people get excited about that, like, wow, that's really short. You could certainly reduce the power, which would stretch out the time for the treatment. The benefit of using the higher power, though, is you have a greater chance that you're going to impact pain from the treatment. So by using the higher power, if you're dealing with something that's chronic and you're not worried about swelling increasing after overdosing something, that's a great candidate to use a little bit higher power and see if you can improve range of motion and decrease their pain from that single treatment. When you have a swollen finger, that's the case where you want to be a little more conservative with your dose and your power, because if you put too much energy into the joint, it can actually cause increased swelling due to the better circulation it's going to receive. So it's always good to start a little more conservative, get a sense of how the patient responded to that treatment before you get a little more aggressive with your dosing when you're dealing with acute inflammation. But let's take a look at what the treatment would look like. Make sure you put your safety glasses on. When you're happy with your settings, you're going to hit the standby button. The reason why using a small treatment head is important is that the spot size will be more precise, and therefore the 20 centimeters square that you estimated, all of that treatment will go into the tissue. If you used a bigger spot and part of it was splashing onto the table, you would not be as precise with the dose that you've calculated. This allows you to make sure that all the energy that you've calculated will go into, in this case, the thumb. You're going to move it at a rate of 1 to 2 centimeters per second. And just sort of paint that tendon in this case until the time ends. If you wanted to treat the palmar side of the thumb, all you would do would be to repeat the treatment and hit go on your handpiece once again and perform essentially the same treatment on the other side of the thumb. The nice thing is that in this case, since the treatment segments are in very small amounts of time, it's very easy to be liberal with the area that you're going to treat. If you thought there was inflammation that was going into the hand itself, or there was pain up into the forearm, you can easily include that into your treatment in an average session. It'd be no problem. Other than that, it's pretty straightforward. Again, use the head of your choice, whichever you're most comfortable with and whichever one gives the most focused beam. If you're trying to work some of the soft tissue or tendon aspects, the on-contact solution might be better. But really there's no wrong choice in any of the 3 small heads when you're dealing with the hand, since you're using the lower power features for this area of the body. Hope that helps. Take care.